Hello, my name is Rich Hawkins. I'm an orthopedic surgeon with the Stebbins Hawkins Clinic in the Carolinas in Greenville, South Carolina, working with the Greenville Hospital System. This is a teaching video to help those of you who are interested in the care of the head and neck injured athlete on the field and transport off the field to the nearest hospital facility. It's extremely important that we manage these people carefully so that we do not worsen their injuries in any way, particularly if they have a neurological deficit. This video will demonstrate the technique of immobilization, how to handle a face mask and remove it carefully, leaving the helmet and chin strap in place, and then carefully log rolling the patient onto a backboard, immobilizing them, and they're carefully transporting them to the nearest hospital. These injuries occur with usually contact on the top of the head and an axial neck injury, resulting sometimes in unconsciousness and/or a neck injury. Breathing must be controlled, and that's why we have to remove that face mask to be sure we have access to the airway. And then immobilization of the neck if it is a neck injury so that the injury is not worsened any further. Our concern, of course, with head injuries that we always have to assume there is an associated neck injury. So with that, we'll pass this on to the trainers in the Greenville system to teach us how to manage these specifically on the field of play.
The log roll technique is appropriate if the athlete is found in a prone position and not breathing. Position the athlete's arm to the side of the athlete before attempting to log roll. The first medical personnel on the scene is the leader. This person should issue all commands.
Can you hear me? You okay? No? There's no response. I want you to go get me some help. Call 911.
The leader should take control of the injured person's head. The leader holds the head with both hands, stabilizing it by holding firmly and allowing no motion.
We're going to have to roll him supine. I'm going to need one person at the shoulders, one at the hips, and one at the feet.
Direct all rescuers to reach across the injured person and grab a hold of the upper arm and shoulder, the pelvis, and the legs. Make sure to grab the body part and not pull on the article of clothing. Roll the injured person towards you upon the leader's call. Roll on 3.
1, 2, 3.
Roll the person down on the leader's call. Down on 3.
1, 2, 3.
If a spine board is available, log roll the athlete onto the spine board. The first medical personnel on the scene is the leader. This person should issue all commands.
I'm going to need one person at the shoulder, one at the
The leader should take control of the injured person's head. The leader holds the head with both hands, stabilizing it by holding firmly and allowing no motion. Position the other rescuers on one side of the injured person, one at the chest, one at the pelvis, and one at the legs. Place the spine board along the other side of the injured person, as close to him or her as possible. Direct all rescuers to reach across the injured person and grab a hold of the upper arm and shoulder, the pelvis, and the leg. Roll the injured person upon the leader's call. Roll on 3.
Ready? 1, 2, 3.
Direct the one remaining rescuer to place the spine board to where the injured person was just lying. Roll the person down on the leader's call.
Down on 3. 1, 2, 3. Okay, slide down on 3. Okay. Justin, come over here. Kelly, come over here. Koya, slide down. Slide down on 3. 1, 2, 3. Slide up on 3. 1, 2, 3.
Removing the face mask allows rescue personnel to examine the airway and vital areas of the face. It also allows them to administer pre-hospital care without removing the helmet. The face mask should be removed in a timely manner without moving the head or neck. Pruners, FM extractors, PVC pipe cutters, trainers, angels, and screwdrivers can be used to remove the face mask, although screwdrivers can be unreliable due to rusty T-bolts and screws. If needed, a bag mask valve can be inserted under the face mask to provide ventilation while the face mask is being removed. If a physician or EMS personnel is available, a more definitive airway can be secured if such intervention is necessary. If the situation is not as urgent, a cervical collar can be placed on the athlete, who then is placed on a rigid spine board to ensure mobilization of all segmental levels. This should only occur with athletes who are not wearing helmets and shoulder pads. Once the face mask has been removed, the athlete must be prepared for transport. Any injured athlete who may have a cervical spine injury should be immobilized on a full body splint. Techniques for spinal immobilization and the determination of whether inline stabilization is required for transport should be left to local protocols or the clinical judgment and training of the individuals who are on site. Positioning the head into a spine-neutral position should be assessed on an individual basis. The equipment used in splinting athletes with head and neck injuries will depend on the appliances available, as well as the training and knowledge of EMS personnel. Typical equipment used includes the vacuum mattress and the rigid spine board. The following are different techniques used for spine boarding an athlete with a cervical spine injury. The lift technique. A 6+ person lift is recommended for all lifts. There should be enough ATCs, MDs, and EMS personnel to effectively administer the 6+ person lift. You may need a 10+ person lift for heavier individuals. You can also use a 4+ person lift for smaller athletes. Lifting with fewer than 4 people is not recommended. This step is omitted if you place the athlete on the spine board in the beginning. The first medical personnel on the scene is the leader. This person should issue all commands. The leader should take control of the injured person's head. The leader holds the head with both hands, stabilizing it by holding firmly and allowing no motion. Position the other rescuers on one side of the injured person, one of the chest, one of the pelvis, and one of the legs. Place the spine board along the other side of the injured person, as close to him or her as possible. Direct all rescuers to reach across the injured person and grab a hold of the upper arm and shoulder, pelvis, and leg.
1, 2, 3. And down on 1, 2, 3.
Once the athlete is on the spine board, you can prepare the chest for early defibrillation if needed. With the helmet and shoulder pads in place, towels or other padding are sufficient to fill the voids. Once the athlete is secured to the long spine board, the person at the head relinquishes his or her control, and the athlete is ready to be transported to an emergency medical facility. Neither the football pads nor football helmet should be removed before transportation unless the football helmet does not fit snugly. A properly fitted football helmet holds the head in a position of neutral spine alignment when the athlete is wearing shoulder pads. Athletes who are vomiting or bleeding from the oral cavity must be kept in prone or placed on their sides to prevent aspirations of blood or vomit into the airway. This can be performed after the athlete is mobilized. Guidelines for helmet removal. Face mask cannot be removed to gain access to the airway. Airway cannot be controlled or ventilation cannot be provided. Immobilization of the helmet does not immobilize the head. Helmet prevents immobilization for transport, such as a bicycle helmet. If the helmet is removed, spinal mobilization and alignment must be maintained because any additional motion could cause further damage to the athlete with a cervical spine injury. Helmet removal should never be attempted without thorough communication among all parties involved. Any athlete suspected of having a spine injury is to be transported by trained professionals in an ambulance. Transportation in a private vehicle is never to be attempted. In certain settings, air transportation may be preferred to ground transportation. A trauma center should be the first choice destination for spine-injured athletes. MDs, ATCs, and EMS personnel should be familiar with local trauma networks and protocols. In remote areas where it's quite a distance to a trauma center, the physician may choose to accompany the athlete to the hospital and participate in the treatment. When possible, the ATC should also accompany the athlete and assist in the removal of protective athletic equipment.
Hopefully this video has been helpful for you in the management of the head and neck injured patient on the field of play. There are some new revolutionary treatments that we adopt in these patients. You've heard of recent athletes receiving cold treatments into the vascular system. You heard of the use of cortisone and sort of reducing the inflammation, hopefully lessening any head injury, swelling, and or neurological injury in the spine. And these are techniques that are applied in the medical field. This video has gone over these various steps, and I think probably it's very important for any of you who are involved in the care of athletes to very carefully understand the principles that we've here taught. So good luck to you, and take care of your athletes on the field of play.